board, and my co-chair, from Bangladesh, who was supposed to be here talking to you now, but was unable to come. And we're really delighted that you are here and looking forward to the conversation that's going to happen over the next 2 days. The World Development Report was a landmark, and Carol has pointed out some of the key things that changed with that report. And principal among them was the sense that when you used money to help improve the health in the country, it was not a cost. It was truly an investment in human capital, in capacity, in cognitive abilities, in child survival, in the workforce, and it had huge implications going forward. The other side of the coin was that where did the ideas for investing in health come from? And we like to think that it came from strong, concerted, consistent investments in new knowledge. New knowledge is another way of saying research. So I went back to the report, which is now available online. And so it makes it very easy to do some word searches. So if you do a search for the word research, there's 164 references in WDR 93. 4 are in the table of contents. 15 are in the acknowledgments because somebody has a title of a research professor or something of that nature. 39 are in the references. And so you whittle down to 2/3 of the references are other uses, and very few of them are actually about research in the way we think about research, of generating new knowledge. So you go to the word knowledge, it's used 20 times. 15 of those times it's related to knowledge that help you to make better choices, but not necessarily about the generation of knowledge. One's in the foreword, one is in a reference. There are only 3 references that talk about generating new knowledge. So in the overview, there's this comment that increased scientific knowledge has accounted for much of the dramatic improvement in health that has occurred in this century. Clear, bold statement. Page 16, increased external assistance for health research that focuses on the major health problems of developing countries could have a very high payoff. And then the ultimate on page 148, and the 3rd reference says, it can be argued that investments in research have been the source of the enormous improvements in health in this century. But the case is not made. And so 20 years later, we find ourselves in a world where some of us advocate for the continued generation of new knowledge, and lots of people say, we know what to do, let's not waste the money in building research enterprise, let's just use that money to do it. And that is a very serious problem. If we allow that to prevail. I'm an infectious disease guy, so in my own field, I know that if we say all we need to do is to implement the vaccines that we have, in 10 years from now, we'll be 20 years behind. There will be no cutting edge, there will be no new thoughts, there will be no new improvements. So WDR 1993 had 3 key messages, which they point out. So foster an environment that enables households to improve health, good idea. Improve the management and efficiency of spending on health, not unreasonable since the report came out of the World Bank and it was driven by economists. And promote diversity and competition in the financing of healthcare. I don't find in the 3 key messages any sense of the need to invest in new knowledge generation. And then the 5 policy recommendations, all of which are entirely appropriate and necessary. Increase schooling for all children, especially girls, invest in public health activities, allocate funding better, and so invest in primary care, reduce waste and inefficiency, and increase community control and financing. And what is missing? It's the case for the investment in research for health. So one of the positions that we find ourselves in now is that the Lancet Commission, and we're delighted to have Gavin Yamey here from the Commission who will talk to you a bit about what it's doing, can make that case in the report. And as I look over the Commission, there are 18 economists, and only 3 people that I can say have a deep and vested interest in research. One of whom is an economist, Dean Jameson, who's the co-chair, who was the lead writer for the 1993 report, was the co-chair of the Commission. So I'm a little bit worried at this point that the Commission's report will come out with very important comments about investing in health, but may not make the case for that continued investment in knowledge generation. And we want to influence Gavin with evidence to make the case of why that's an essential component of what we do going forward. So that's the challenge in the conversations and the discussions that we're going to have. So let me leave it at that. I think that the opportunity is here for us to think openly and thoughtfully, to try to understand what the place and role is for research investments and see where it carries us over the next few days. Thanks very much. This has been a very rich 2 days. I want to come back to where we started this colloquium got developed out of a mutual connection between the Commission on Investing in Health and COHRED. And so the agenda came out of the interactions. So I'm now trying to sit back and very succinctly just pick up on a couple of points. This has been a rich and diverse discussion. So I won't touch on everything that's been talked about. And I'm going to do it in kind of a bullet fashion. So the first thing I take away from this is that research actually does drive health improvement. We had various conversations. We talked about failures and success. Failures are good because they provide lessons. But it's success that drives an agenda forward. So we don't forget about the failures, but we need to focus on the success. And I think there was a number of examples that were either presented or talked about in the discussions where research actually pays off beyond the investment in the research. There's always a question of why put money into that rather than into health care, where the return on the investment is enormous. So the value of it, I think, is really extraordinary. So just 3 quick examples. In contemporary science, the concepts of reverse vaccinology, and developing a vaccine based on genome, has actually had a product developed out of it for group B meningitis. The translation in that space, the meningococcal A vaccine in Africa to deal with epidemic meninge A in the Sahel. And then at the community-based level, we can go back to the vitamin A story. You heard briefly from Keith earlier about these massive studies. Think about the cost of those massive studies. And then think about the return of the investment in terms of lives saved. Huge. So I think the point has been made. I just saw Gavin is right there. Gavin is going to have a lot of meat for the examples to drive that point home in the report. I think we have to keep in mind that there's a time frame that most people are unrealistic and impatient. There's a time frame from an insight to an impact, and it's not one day, it's not 1 year, it's a long time. frame, and that point has to be driven home as well. So we have to be very realistic on the direct economic implications of the investment in research. It stretches out over time. Second, a lot of talk about research capacity and whether you call it building or strengthening. It depends where on the spectrum a country is. The capacity is both in the human as well as in the institutional context for it. And a couple of key points I think that came out is that for the individual investigator, whether it's brain drain, brain circulation, networking, internal, external, it doesn't matter, there has to be a career path. And the career path issue is that we heard that, and I think Pascal was talking about it among others, that individual researchers have multiple responsibilities. And they don't have time to do the research. And the career path doesn't support them to be full-time researchers. They need a litmus in developing this research system. And where do they want to go, and in what time frame? And then what do they need to do to go from point A to point B? And to be very pragmatic. There's an issue around communication, and we heard north and south, south and south, some south and north. That's all good. I think it's necessary. But there also needs to be communication among and between investigators.